Can you give me a snapshot of your role in the medical travel sector, please?
Sure. We are Philadelphia International Medicine. It's a consortium of two academic medical centers. They're universities, they're medical schools, they're physician faculty, they're nursing schools. And so what we bring to the market is their combined knowledge base, which is considerable. We're six hospitals in a network, and we primarily aim to take care of patients who have life-threatening diseases.
So can you describe the nature of your international patient business, please?
Sure. We see patients here in Philadelphia from 43 different countries last year. They come from just about anywhere, but we have a majority of our patients come from the Middle East. The second catchment area, if you will, comes from the Caribbean, and Bermuda, one of it's closely affiliated with the UK, is probably our second largest source of patient referrals. Canada and Europe, and and then we have patients from almost anywhere in the world. Typically, a patient will come here for cancer, treatment for cancers, for transplants, bone marrow transplants, solid organ, and as well. They come here for neural diseases, for really high-end, sophisticated medical procedures. What we don't typically see are patients coming here for more of the medical tourism type of procedures, dermatology, plastic surgery. That's really not what our program's about.
Okay, who do you see as your competitors?
The Philadelphia International Medicine Network has been in existence for 16 years. The competitors when we started versus today are very different. So in the beginning, there were about 10 programs in the United States that were very active in this environment, and they being the obvious, the Johns Hopkins, the Cleveland Clinics, the Mass Generals, etc., MD Anderson's. Today, I'm on the board. The United States has an association of hospitals that have international programs, and I'm one of the board members of that. It's an advisory committee similar to a board. We now have 50 members. So there are at least 50 programs in the United States that are actively engaged in international healthcare. But that, your competition is yourself. If you don't adhere to standards, if you don't worry about what you're doing with your patients today, then it doesn't really matter what the rest of the international programs are doing. You have to work towards your ultimate standard, and therefore your competition is yourself. Do we care about what the other programs are doing? Of course. And today it's not just those 50 programs in the United States, it's truly global. So our competition, is London, it's programs in Germany, it's programs in Costa Rica, Colombia, India. We are not here to, some distinctions is, we know that we can't compete on price. That's not what American healthcare is about. So what we try to do is compete on offering a patient outcomes, quality, and not that other programs don't provide quality, but we're really concerned with the patient, as I said, that has life-threatening diseases, because I think that's our niche and that's what we can perform best on. So the bulk of our practice is those patients from around the world who can't get that kind of care at home, or because of either time constraints or it's just not available.
So why should people come to London for the IMTJ Summit?
Well, if you're in the global marketplace, and unfortunately, although we're dealing with healthcare, this is a global marketplace. So you have to learn about what others are doing. We're not working in a vacuum here, and there's no better place to get a sense of who you are and where you are in this field unless you meet with leaders from other programs around the world. And there's no better place than going to London to meet with those people. Everybody's there under one roof. And it's a great opportunity. It's a marketplace of ideas. And that's what you need to do to continue to grow your program.